Good afternoon, everyone. I'm Governor John Carney. Thank you for joining us today for our weekly press conference on Delaware's response to COVID-19. We continue to make really good progress. We have some important information to share with you today as we come out of the important Memorial Day weekend. Important not just because it's the traditional beginning of summer, but more importantly, it's the way we remember those who made the ultimate sacrifice, our men and women in the military protecting our freedoms here and around the world. We take the opportunity to say thanks and express our appreciation to those who serve today, as well as to the men and women veterans in our state. We have a number of solemn ceremonies across our state. Importantly, a gathering at the Veterans Cemetery there right on the C&D Canal, where we had a program on Saturday in pretty inclement weather with lots of rain and cold and wind, but there were warm hearts under the tent as we expressed our thanks to the Gold Star families, which we did again on Sunday. And we were honored with the presence of our President of the United States, our own native son, Joe Biden, someone who's been at the ceremony at the Memorial Bridge for probably closing in on 50 years, 36 years as our United States Senator, a number of years as Vice President, and now once again as President. It's a solemn day and a difficult day for him and the Biden family as it comes on the anniversary of his beloved son Beau's passing. And we take the opportunity again to remember, to share our appreciation to the Gold Star families who are always represented at that event. There are wreath laying ceremonies. We completed the weekend with the annual parade that's been running over 100 years down Delaware Avenue in the city of Wilmington, and again with speeches and remarks at the end and wreath layings and the playing of taps. So an important weekend as we celebrate the freedoms we enjoyed by those who secured it. We're joined again today by Director A.J. Shaw from the Delaware Emergency Management Agency. He's been our point person working with the public health and our partners, hospitals, first responders, paramedics across our state, both in testing and vaccination. We'll have updates from A.J. on those. And of course, the Director of our Division of Public Health, Dr. Carol Rattay, and her team at Public Health. Pam, our sign language expert for the deaf and hard of hearing, joins us as well. So why don't we go right in and get to the data update. You'll see some really good numbers now. New cases on a 7-day moving average down to 60, significantly below that 100 case threshold that we talk about a lot. Percent positive on a 7-day moving average. Many a day we have percent positives under 2% overall on the 7 days, 2.2%, significantly below the 5% target that was set out for us by the World Health Organization months ago. We're under 50 now with hospitalizations. We'll see that chart in a minute. And then, of course, sadly, still 1,661 precious lives that were lost to COVID-19. These data and data like these across the country and the efficacy of the vaccine led to the advice from the CDC over a week ago to relax mandatory mask wearing for those who are fully vaccinated. We do still have requirements in place. We'll talk about that in certain settings. And the guidance recommends that those who are not fully vaccinated to make sure that they get vaccinated, if not to wear a mask because they're still at risk. And we'll talk a little bit about that when we look at the demographic groups and the vaccination rates for each. So next you see the hospitalization. This is a really good snapshot picture of the spread of the virus in our state going back to its appearance here first in early March of 2020. You can see the run up in cases and hospitalizations. This is hospitalizations back in late April, early May of 2020, as we started to shut down portions of the economy and had people shelter in place, so to speak, as well as the wearing masks and all of the mitigation protective measures that we took, you can see the decline in those hospitalizations, which corresponded with obviously a decline in cases, the severity of the cases. We don't have vaccinations at this point, obviously. We get into the summer months and you can see hospitalizations are down, positive cases are down. We're starting to do significantly higher number of tests during late summer and into the fall. And then you see we have this tremendous run up in positive cases, the spread of the virus, severity of those cases and hospitalizations, with a peak after the Thanksgiving, December holidays in early January at 474 people with COVID-19 hospitalized across our state. It's important to point out, as I have in the past, that even at that level, given the measures that the hospitals took to keep people who didn't need to be in the hospital setting from being there, we had room and capacity to treat those that were critically ill, and that was an important learning for all of us. We got better as we got into the new year, really leaned into it in terms of protecting those from the spread of the virus, and you can see the decline in the number of hospitalizations as the virus, as we tamped down the spread of the virus, and we hit a low mark there in hospitalizations on March the 11th at 83, and then another run up a little bit to 180 in April. And since then, steadily moving down. This is the latest number we have, which was Sunday's number at 48, or was that yesterday's number, I guess. So let's take a look at our success, our progress being made, vaccinating Delawareans. We are making significant progress here. Just a reminder to everybody, the goal the president has set for all of us is to meet 70% of adult Delawareans, adult Americans, to get at least one COVID-19 vaccine by 4th of July and celebrate Independence Day in a way like none other. Right now, almost 1 million vaccines have been administered here in Delaware, fully vaccinated, 421,000 almost, and that represents, these are CDC numbers, and we haven't received the latest, but that represents 66% of Delawareans 18 and over. So that's the target population. We're trying to get to 70%. The simple math is that we have about 17,000 more people to vaccinate by July 4th. So that's less than 1,000 a day. It's about less than 5,000 a week. AJ, I think we can do it. We have some incentives that we'll talk about in a minute to reach those goals. Importantly, almost 92% of Delawareans 65 and older, we know that's the most vulnerable population, have received at least one dose, and we expect with and the 2-dose fully vaccinated of that demographic is in the 80% as well. So highly vaccinated seniors. Let's look at the subgroups, the demographic subgroups that aren't vaccinated at quite that rate, meaning that they should be, if not vaccinated, wearing masks on the advice of the CDC, and that they are at greater risk, particularly if they're circulating as young adults do, ages 18 to 34, among one another, bars, restaurants, gyms, and salons. Only 38% of Delawareans 18 to 34 are vaccinated. Only 29% of those teenagers 12 to 17. Now, they've only been eligible for a certain period of time. We do have incentives for both of those groups to help them to take that step and get vaccinated. Moving up along the demographic, and you see from 35 to 49, just a little over half. And then those of us who are older, from 50 to 64 at 67%, almost at 70%. And then those of us, I just turned 65, so I'm in this last bar, over 90% vaccinated. But we need to get the other groups And we have a vaccination program with incentives that we call DE Wins. So you can learn more about DE Wins at the dewins.org website. There it is, dewins.org. Everybody wins in Delaware when everybody gets vaccinated. You protect yourself, you protect your families, you protect senior citizens are very well protected already with plus 90% with at least one vaccine and over 80% fully vaccinated. But we need to get those younger age groups more fully vaccinated. And we need to get about 17,000 additional Delawareans vaccinated in order to meet that 70% goal that the president has put out for us. So we just had our first drawing yesterday. I had the privilege there. That's me in the picture with the mask on because it is a state facility. We still require mask wearing in state facilities. I'm pressing the button on what is called the randomizer. Everybody else, media and others, were outside of the room just to protect the integrity of that process. The two gentlemen sitting at the table and the desk, the one big computer in the corner of the room is the randomizer itself. And this randomizer assures that everything is done randomly. There's nobody picked for a particular number, just to give you some idea to assure you and the confidentiality and anonymity of this process. All those who are eligible for these prizes, say 16 and over, 16 to 18-year-olds, 18 and over, and adults, are randomly assigned a number with their record in the Delvac system. So we know that they've been vaccinated, randomly assigned a number. Just those randomly assigned numbers, no other information goes to the lottery office. So essentially they have a database of numbers. They double randomize them again. They have 3 different programs that they use with 2 different methods of randomization. And they come up with numbers that are totally random with no connection whatsoever. They have no information there at lottery about your health record, your name, your address, any of that. They just send those numbers that are selected when I push that button there and the computer spit out the numbers on the machine. They go back to the Division of Public Health, who then retraces the step, connects that number with the record, and then makes the contact with the winner. So this week we picked a $5,000 winner. You know who you are, or you will know who you are soon when DPH reach out to you. I have no idea who you are. 2 Delaware State Parks passes, so seasonal park passes for 2 of the winners are in the raffle. And then a Wilmington Blue Rocks luxury suite, so 20 or 25 tickets with all the things that go along with that at the Blue Rocks in a big box there at the Blue Rocks Stadium. That was for the drawing yesterday. Importantly, we also have a partnership going under DE Wins with small businesses, those who were most negatively affected by COVID. So bars, restaurants, gyms, salons. You can sign up and you can find out what these incentives are. We've provided financial resources to the companies. They have determined their own, and we'll give you 3 examples in a minute. And you can see what they're offering at dewins.org/partners. That's dewin.org/partners. So let's take a look at what some of them are offering. So Milton Theater got resources to provide these incentives. So 2 free tickets to an upcoming show with the proof of your vaccination. So you take your vaccination card to the Milton Theater, you get 2 free tickets to an open show. The one that I like, loving those Italian restaurants, you get a free spaghetti and meatball dinner with proof of vaccination at Mrs. Rubino's on Union Street. Mrs. Rubino's, some of the best spaghetti and meatballs you're going to find there on Union Street. Dine in only, so you got to go in, you got to go eat, bring some other people with you. You only get 1 dinner, so other folks got to eat too. And you got to just show your proof of vaccination. So that's a good one. Another good example is Keys Cookies and Cupcakes. They're in Clayton, Delaware. Go in with your vaccination card and you get a free cookie and cupcake bundle. That suggests more than one to me. You'll have to go in there and find out one per customer. So you only got one vaccination. You only get, well, you might have had two vaccines, but you only get one bundle there. Lots of other, those are just three small examples. The purpose is win-win. It's an opportunity to encourage people to go out to the small businesses that were affected so negatively during COVID-19, gives you an incentive to be vaccinated, rewards you for being vaccinated, and gives you a good incentive there. So the next raffle will be later this week. You have to be vaccinated by June the 3rd, which is Thursday, for your chance to win Firefly passes. So all those folks that like to go to Firefly, you haven't been able to get your passes, you get this raffle will include Firefly passes, and I understand camping accommodations as well. There's a whole package there. You can see the cooler, the t-shirts, and the other things that go along with that package. So we'll also have, again, it's for ages 12 to 17, all those who've been vaccinated, those ages, Funline prize package, Delaware State Parks annual passes, and then for those 18 and up, the Firefly package and another drawing for $5,000. So some good incentives there to make sure you get vaccinated. We'll have additional big drawings at the end of the campaign, $302,000 prize that will be raffled off for everybody who gets vaccinated by June 30th. So this is the next slide. There you go, June 30th, the final raffle for all people vaccinated. 2 low number license plates. I'm told 4 digits now, so 2 low number 4-digit license plates raffled off with $302,000 for everybody that gets vaccinated by June 30th. Those are some good incentives. Take advantage of them. Get vaccinated. Everybody wins when everybody's vaccinated. Dr. Rattay?
Thank you so much, Governor. So let me start with data. Again, for the second week in a row, we have no areas of concern in our states. Also good news, as the governor touched on, our case rate has decreased 33% since last week and is the lowest since mid-August of 2020. Our positivity rate has decreased in all 3 counties. Hospitalization and death rates have also decreased. So everything's headed in the right direction there. Our children ages 5 to 17, as well as young adults 18 to 34, are the groups that have the highest case rates in our state right now. So overall, we are very encouraged by this news, but it is critical that we continue our efforts to promote vaccination, especially among our youngest eligible Delawareans. So let's talk a little bit about variants. Just want to start with a mention that the WHO is renaming the variants by giving them names based on the Greek alphabet. So we'll soon be transitioning to these new names, but meanwhile, using the old names in Delaware, the number of UK and Brazil variants continue to increase, as does the number of India variants. Last week, you may recall that we announced our first case of the India variant, and we are now up to 4 cases identified. Now, our public health laboratory, has sequenced already 2,690 specimens for the COVID-19 variant strains to date, including 135 in the last week. And this time, we had a larger percentage of variants that were positive for a variant strain. So this past week, 69% of the specimen that we tested were positive for a variant strain, which was up from 49% the week before. Vaccination remains effective against the variants that we are seeing. These variants, again, tend to be more contagious. So please protect yourself against these circulating variant strains. If you have not already, get vaccinated as soon as you're eligible. But if you're not vaccinated, please continue to wear face coverings and social distance 6 feet or more from others if you are not. So let's talk a little bit about vaccination rates. The governor already touched on this. Vaccination rates are certainly different among various age groups. And so as you can see on this slide, we're really doing well with our senior population has done a great job leaning into vaccination, where 90% or more have received one dose of the vaccine and 81% are fully vaccinated, which is really great. And a big reason why our death and hospitalization numbers have decreased so significantly. But as you go to the younger age groups, we see continuous declines. So our 50 to 64-year-olds are doing pretty well, with 55% fully vaccinated. But as we get a little younger, 1/3 of the 35 to 49-year-olds are fully vaccinated. And when we get to our youngest yet, among the 18 to 34-year-old age group, only 1/4 are fully vaccinated. And among the 12 to 17-year-old group, we have about 8.5% are fully vaccinated. These last two groups have been eligible for vaccination for the shortest period of time. So it's not surprising that less are vaccinated. And of course, for those under age 18, they're only eligible for the Pfizer vaccine. So it's important for those who are looking for Pfizer for children to check out the website to identify places like our DPH clinics where you can get the Pfizer. But again, I just want to emphasize our highest case rates right now are among those children and young adults 18 to 34, where we have the lowest vaccine rates. We continue to offer vaccination opportunities in smaller locations like fire companies. Like we just did 36 vaccinations in Roxana and 54 in Laurel. Hospitals and community-based groups are finding innovative ways to deliver vaccines in smaller locations like Beebe, taking out that bookmobile in Sussex County to small areas like Selbyville. So if you know of an event or an activity that would be helpful for reaching people to get them vaccinated, especially among our youngest age groups, please email us at vaccineevents@delaware.gov. And of course, we are incentivizing people to get vaccinated, and we've just expanded the gift card portion so that medical providers and other vaccine providers, including those who work with community-based partners, can request gift cards for their patients or events. So we're excited about that. So lastly, let me talk a little bit about the safety of the vaccine. It's important that we continue to educate as much as possible. We know that some of the myths that are out there are creating barriers for those who haven't gotten vaccinated yet to take the step to get vaccinated. We are asking every medical provider now to build in new processes so that they make sure that every patient they see asks that question, have you been vaccinated? And if not, they can begin a conversation and find out why. Sometimes it takes several conversations to make a patient feel comfortable enough to pursue vaccination for themselves. And what they are finding and polls are finding is that a lot of folks are reluctant because of things that they have heard or seen on social media often. And so I wanted to share some of the myths or concerns we've heard about and provide accurate science-based responses. So myth number one that we hear, the vaccine will alter my DNA. And the fact is none of these vaccines will interact with your DNA and therefore cannot alter it. Another myth that we hear a lot about is people think that the vaccine injects you with a microchip. And this also just is not true. The vaccines contain a variety of salts and fats and other chemicals, but no microchips or tracking devices. If you're interested in seeing a list of vaccine ingredients, you can go to de.gov/COVID vaccine. And you'll see a document under a tab that says allergy and ingredient list, and you'll find more information there. But I just want to reassure you that there are no microchips or tracking devices associated with these vaccines. Myth number 3 is a big one. And we know that this one has gotten a lot of traction on social media. And that's that people who are trying to become pregnant now or who plan to try in the future shouldn't receive the COVID vaccine because it could cause problems with fertility. And the fact is, there is no evidence whatsoever that fertility problems are a side effect of any vaccine, including the COVID-19 vaccine. In fact, thousands of women who were pregnant during clinical trials or have gotten pregnant since getting the vaccine and have had no problems. No loss of fertility has been reported among vaccine trial participants or among the millions who have received the vaccine since it was authorized. So according to the American College of Obstetricians and Gynecologists, or ACOG, they say there's no evidence that the vaccine can lead to loss of fertility, saying it is scientifically unlikely. Women in the clinical trials successfully became pregnant following vaccination, and there have been no safety data at all to suggest that the vaccines impact the ability of a woman to get pregnant. Similarly, the Society for Male Reproduction and Urology recommends that men who desire fertility should be encouraged to get the vaccine when they're eligible. And finally, I just want to add that there's no evidence that the vaccine impacts adolescent development or puberty in any way. So to get more information about these myths and others, again, you can go to de.gov/COVID vaccine under our frequently asked questions section to get more information. But I hope that this has provided reassurance to some people who have been concerned about these vaccines. I will say one final perceived barrier that I've been hearing about is that there are many people who think that the vaccine might cost too much, and there is no cost to getting this vaccine. There should be no out-of-pocket cost for anyone to get this vaccine anywhere. If anyone hears otherwise, that's something we would want to know about. Finally, I just want to end with a huge shout outs. We have had some amazing partners throughout this pandemic and during this vaccination campaign. This week, I want to give a big shout out to some of our Kent County partners, the Kent County Coalition, Reverend Rita Page, and Bay Health. The Kent County Coalition is a newer group, and given the population of Kent County, they hold smaller events, so they may not receive the same level of attention as others in other parts of the state. But we really want to thank them for their outreach to vulnerable populations in churches, the Modern Maturity Center, and even the Housing Authority to improve vaccination numbers in Kent County. So again, thank you so much to Kent Coalition, Reverend Rita Page, and Bay Health for your partnership. And with that, I am going to hand it back to the governor.
Thank you very much, Dr. Rattay. Nothing to those rumors. Thank you for separating fact from fiction. What we do know about the vaccines is that they are incredibly effective in preventing serious illness, hospitalization, and death from COVID-19. And we obviously, our senior citizens understand that. They've been eligible for the vaccine since December and have been vaccinated at very high rates into the 90% with at least one dose. And then the numbers get smaller in terms of vaccination rates until you get to the younger children, teenagers who just recently became eligible and actually they're doing pretty well in terms of getting vaccinated. And we need your help with that. Special thanks again to Reverend Rita Page, Bernice Edwards down in Sussex County, to our federally qualified health centers for stepping up. Lorette, the West Side, Henrietta Johnson. They've just been great partners. Our hospitals, of course, and then the Division of Social Services street outreach teams have been out on the street, knocking on doors, passing out information about getting vaccinated. Now we have the incentives, and so it's even more reason to go take that step and get vaccinated at a clinic and an opportunity near you. right at the point on testing and vaccination for months now has been AJ Shaw. AJ, we continue to test at pretty high levels, I think, considering that the spread of the virus has gone down so much. So many people have been vaccinated. We need that obviously to measure, and even with those lower numbers, we're still getting even lower numbers still in terms of the positivity rates. So that fraction of positive cases over number of tests done. So AJ, give us an update there on testing and vaccination.
No, thank you, sir, and good afternoon. And I think as we look over the testing numbers, that's one thing we should point out, that the percent positive continues to go down even as we're testing fewer people. So that just helps us show that the community is getting healthier, that the vaccines are working, et cetera. So it's definitely, if there is some good news with it, there it is. But, we did see a significant increase, probably our biggest decrease that we've seen in testing ever, about 4,000 last week. Again, I expect this to decrease again next week as, the universities and colleges are finishing up for the year. High schools in sports are finishing up, and they had a lot of voluntary testing as well. So, however, go to de.gov/get tested to look at where the testing sites are around the state for the next week. On the vaccination front, we had a great meeting this morning with Diane Hainsworth and Monty and Deldod and some other people, including the police chief and others, to really kind of put a vaccination event that's been on our list. It's been on our to-do list probably for months, and I think it's about time. It's perfect time for us to do this. And so, in partnership with the Starboard and Monty, we will be doing a vaccination event with Diane Hainsworth and her team this Saturday evening from 4 to 9. This will be either Pfizer or Johnson & Johnson. It will be right over on Salisbury Street. So again, thank you to the town of Dewey. Thank you to Starboard, and all the partners are going to make this happen. And again, we were doing 5,000 events, just a few weeks ago. And now when we're able to get 100 or a few hundred people, it's a win. And it's going to be events like this, and this takes us on to our next slide of how we're going to have our tempo throughout the summer. So Curative, the testing and vaccination partner that we've had now in the state for over a year. We did our first Curative event just before Memorial Day last year. So it's hard to believe it's been that long. We are going to, at the end of this week, they will no longer be at the Dover Dell Tech site. They will be using that team and personnel and equipment to actually go around to mobile sites throughout the state as we find areas that have lower vaccination rates or events that might have a high number of people from foot traffic where we could try to target them that way. So starting next week, so for next week's schedule, they'll be at Dell State University to support their vaccinations effort. Then they'll be back up for the alfresco evening in Newark on Wednesday. Thursday, we're looking to be somewhere down in the Rehoboth area, so still finalizing that. Friday will be Delaware Dell Tech Dover. That's to still have a presence there and also help people that need their second doses that got their first dose shot there as well. And then they'll be at the Milford Farmers Market. And this team's going to be going to events like this, probably Tuesdays through Saturdays, and others as needed as we identify where will be a good area to have them. So that's it for us this week. Governor, back to you.
Thank you very much, AJ. So bottom line is we've got about 17,000 vaccines that we need to deliver by 4th of July, by June 30th. We want everybody to have an opportunity for that prize of $302,000. That will be in a universe, hopefully, of 770,000. That's our target for adult Delawareans. So those are pretty good odds when you think about $302,000 in that kind of a universe. Again, totally randomized. Nobody knows who you are. No health information from Delvax gets shared with the lottery office, and then they will select the number. We've got other prizes coming on a weekly basis. We also have 2 low digit license plates that will be raffled off as well there, and you need to be part of it. So go to de.gov/getmyvaccine, or you can call that number there, 833-643-1715. Delaware wins, when we all get vaccinated, go to the website, dewins.org, find out the participating businesses, small businesses, and the various incentives that they are offering. Get that spaghetti and meatballs dinner at Mrs. Rubino's. I'm sure there are other Delaware delicacies on that list as well. Thank you for joining us, and look forward to any questions that we have from the media that have joined us today.
All right, first we'll go to Brandon Holbeck from the News Journal.
Thank you. I just wanted to see if you kind of have a gauge, since we're a few weeks into the 12 to 15-year-old age group, if you have a gauge yet of whether you've seen the response from people that you were hoping to, as far as their willingness to get vaccinated, now that we're a couple of weeks into that 12 to 15 age group.
Yeah, so if you go on the website, you can see the week by week trajectory of vaccination administration in the state. And so it gradually rises. The numbers get bigger each week. Back then, as the supply increased from the federal government, then you can see it kind of crests as the demand starts to level off. Supply continues to increase, by the way. Eventually, we were turning down vaccines from CDC. And then as the demand and as the older age groups get vaccinated, it slows down even a little bit more. We've been seeing, it's too early to say, I think, but we've seen a flattening of that trend downward. Now, there are lots of other things that are happening, including the opening, but also the incentive package. So we'll be able to know better in a couple weeks what the effect has been. Again, the more people you get vaccinated among the willing, the harder it gets each increment down the road.
And then my second question, looking ahead to next school year as we wrap up this school year, is there anything that you need to see in the data or that you're preparing for to be able to drop some of the restrictions like mask wearing and social distancing that we still have in place in schools?
Yeah, so there are some things, and I in our White House call just this morning, there were questions from some of the governors about just that, what CDC was going to do with respect to those the guidance that was provided for this current school year. Our number one objective is to get all the school children back for in-person instruction. Now, there are limitations for doing that with the current CDC guidance in terms of mostly distancing and to a certain extent classroom configuration. But we'll be working hard over the summer and hopefully get on a timely basis that new advice from the CDC about that so that we can have all children back for in-person instruction. Dr. Rattay, anything you'd like to add to that?
I would just say the CDC came out with new camp guidance on Friday, which I think is kind of a good transient indicator of what to expect. Again, there's clearly unknowns as to what things are going to look like in the fall as far as our case numbers. But they're suggesting that kids who are vaccinated, who are 12 and up, certainly can be treated very different in the camp setting in comparison to those who are not able to be vaccinated and who are under 12. So, more to come. I think we'll continue to learn. But, an important point out of this is for those who are 12 and older, it is really, really important that they take advantage of that the vaccine is so accessible right now and over the coming months to help protect them and their classmates as they go back to school in the fall.
All right, next we'll go to Tim Mastro with Delaware State News.
Hi, everyone. I have a question on, with the new regulations, there's still, for events over 250 people, I know you still have to apply for, I guess, a special permit. If you could just talk about what you've seen so far, how many permits have been applied for, have any been denied, and what should people look out for if they're planning an event like this to make sure they're adhering to all the guidelines?
Yeah, I don't have those data top of mind. I don't know whether Dr. Rattay does, but we can certainly get it for you. Dr. Rattay, do you have any of that data?
Yeah, I can't tell you how many applications there have been for events over 250, but I know Jamie Mack and our team works really hard with organizers to help support a safe plan and not to reject plans, but to make sure that they're putting plans in place that are continuing to keep people safe, especially in the indoor settings. Where there may be more people who are not vaccinated.
All right. And Governor, you actually just kind of touched on this, but I was going to ask, and just in terms of vaccine supply, if demand keeps lowering, what are we going to decline any vaccine from the federal government? Just what's the situation there in terms of what we're accepting?
Yeah, we already have declined some. I want to say, and I'll ask AJ to help me here, 2 or 3 weeks ago, a little bit, we did get some extra Johnson & Johnson vaccine that was not being used in West Virginia because we feel like we can use Johnson just one dose. It's preferred by some populations. There is, we heard on the call this morning, some of the states had some extra Johnson & Johnson and they were running in to the expiration date. So you need to use that before it expires or do something around the expiration date. So yeah, I think if we have more J&J, we might, there's some problem they've had with a facility in Baltimore that's not permitted by FDA, I believe. That slowed things down on the Johnson & Johnson front. But right now, we can't use the amount that's being allocated to Delaware based on our demand. AJ, any update there?
So the only other thing I'll add is, we've taken what we can to make sure we could secure it properly and have it when, the demand's there, as well as being good consumers and not taking it from other states that might need to see it. So I know Dr. Hong, they works with partners at this CDC as the allocations come out and make sure we're very strategic. So, we're in a position right now where at least we know we have more than enough in state now to get us through where we want to be to that 70% goal, but still looking to, exceed that as we can.
So going back to the reference to the chart in our data dashboard there, basically our allocation continued to grow after our demand crested and started headed in the opposite direction. So just for a point of reference to you, how much is out there? It's still kind of allocated in our name, in the state of Delaware's name, but we haven't called on it.
Okay, the remaining press don't have their hands raised, so I will move to the pre-submitted questions. The first question is from Melissa Steele at Cape Gazette. AJ discussed this earlier, but will the state be offering any more mass vaccination events like the events at Dover Downs or other large venues?
Yeah, so AJ can probably answer this. Right now, we don't have the demand for them.
So simple as that. I think, the governor talked about the 17,000 people we need to get to hit that 70% mark. We'd love to be able to do a few more days out at the Speedway and get them. But right now, we know we have to go to communities. We need to partner with community groups, churches, restaurants, where we could get that foot traffic and help educate those people and get them interested in getting vaccinated. So if for some reason the demand changed, we'll definitely turn that option back on.
So if you think about it, at the height of the demand, we would do 15,000 in a weekend at Dover Downs. And we only need just short of 17,000 to meet our 70% goal currently. So that gives you some idea of the decline in the demand.
Next question's from Chris Barish at WHYY for Governor Carney. At what point do you foresee lifting the state of emergency? Are there any metric benchmarks that you are shooting for?
Yeah, so we've answered this a number of times. We are taking down and sunsetting parts of the emergency order as we go, as they're unnecessary. There are still certain things like the requirements for mask wearing in certain venues, congregate settings, in schools, etc. There's also a number of things that we've done under emergency order powers to enable hospitals and other healthcare providers to get the healthcare workforce that they need. Some of that has been turned into legislation and changed, but we'll continue to look at that and roll back the things as we were able to do so. The sooner the better, from my perspective.
All right, this is the last question from Chris Barish at WHYY for Dr. Rattay. How many fully vaccinated people have contracted COVID-19? He says the number was 70 on April 13th. Since almost all cases are still non-vaccinated people, beyond urging them to get inoculated, what's your message to them about the risk to their health if not doing so?
Yeah, great question. So we've only had 330 breakthrough cases in Delaware, which when you think about, the hundreds of thousands of people in Delaware who've been vaccinated, that's extremely rare. Very effective vaccines. The flip side of that is to not be vaccinated. You do continue to put yourself at risk. Now we know that deaths and hospitalization have decreased, and that's especially because our seniors have really leaned into getting vaccinated. But for those younger populations, there's still significant risks. Long COVID is relatively common. There's some studies that are suggesting it's about 35 to 40% of people who get COVID have more chronic symptoms, about 80% of those with a chronic fatigue, and some individuals, about 50%, with either headaches or brain fog. So COVID is really not an infection that anybody should want to get or to have. So we all should do everything we can to prevent getting it individually, but it also, and this is very important, the more and more people in our state that get vaccinated, the more likely we are to be able to prevent a third surge coming upon us in the coming fall.
That was the last question.
So that being the last question, again, thank you all for joining us as we complete our remembrances of Memorial Day. Once again, I think it is appropriate to thank those who spend so much time and energy supporting our veterans. The best way to honor the dead is to take care of the living. And we have incredible people at the Veterans Home in Milford who, under very difficult circumstances, have protected those veterans from COVID-19 over the past year, very successfully, I might add. The Delaware Army and Air National Guard, the men and women of the Guard, have provided the backbone of our response and just been an incredible partner with AJ, Dr. Rattay, and their teams. Whatever we've asked them to do, they've done it and done it well. And then the VA hospital just outside of Wilmington, they have just been incredible. They've got one of the highest rates of vaccination for the 25,000 veterans for whom they're responsible for their health care, making sure that they get vaccinated. Almost 70% of those 25,000 have been vaccinated by our Delaware VA. So thank you again for joining us. Please, again, say a prayer for those who made the ultimate sacrifice in the Gold Star families, and remember our veterans today.